Kitab kalenjin nguno namache kityo haibun report nota nego kishabun netinyegei ak lekiwirchini konda miondo nota bo fistula imuch kikas miondo nebo fistula anan kotom ikas konito ko report newendi konoisin en orit missing akobo mionitok tuguk cheibu mionitok bo fistula kabarunoik chebo miondo bo fistula ak konyoiset noto bo miondo nebo fistula ako mache ameten report nitok asiyeiwongei keweksei ak tondet en oliep studio kimiten ak director nebo KVDA noto ko Mheshimiwa Ruben Chepsongol kunotok matiloitu. En emotinwek chebo ngwony komugul kobune kwonyik cheite million 2 kaimutik chetinyegei ak miondab fistula. En emotinwekab Sub-Saharan Africa komakiityin fistula ko miondo kityok kobaten kaimutiet nekorom neipchin elfusiekab kwonyik kosob sobonwek chebo katabanet, sasisiet ak ngwonindo nekiungjingei. En emetab Kenya komiten barak missing kaitetab kwonyik chebune kaimutioni chemakyingei konyoiset ak ripset neo. Akot kounotok komiten komang'unet. Kiwirchini konda atindoniot neung'at nebo miondab fistula ak nyigonik cheikotorchigei waletab sobonwekab kwonyik chetindo mionitok. Ingenyorun Samuel Munyoki, kanyoindet netindo maget neo missing nebo kotoret en kaosusetab kaimutietab fistula. Manyoise kityo Samuel kobaten indochin tetutik chetinyegei ak fistula, ineti kanyoik alak ak ng'ololdechin biik chekikitaban en tetutikab kanyoiset.
My name is Samuel Munyoki. I'm a nurse by training, a registered nurse, specialized in fistula. So at Gynocare, I do program coordination for the fistula program. That includes treatment of patients with fistula. It includes training for staff in fistula. It includes international relations. And it also includes outreach to find women with fistula.
Fistula ko mang'oliot kityo neboisien kanyoik ak ng'amotikab kanyoiset. Inoni ko walutiet netinyegei ak sigisiet ako imuch kowal sobetab kwony kipchulyo. Fistula ko kaimutiet nereben kwony kamuget nebo korib tililindanyin ak kong'em tekistanyin.
Fistula is a broad term. Basically it means an abnormal opening between two organs in the body. That is the simplest way of describing it. If it occurs in a place, in a cavity in a body with another cavity, that are not supposed to communicate, it causes a problem. And in this case, we'll be talking about female genital fistula. That means it's a fistula that connects the birth canal to the urinary bladder or the birth canal to the alimentary canal. The significance is that when you connect those parts, excreta, which is normally supposed to go in its own way, goes out the wrong way without control. And for the sake of the bladder, urine leaks without control.
Kit neindoi en bitunetab kaimutietab fistula ko sigisiet nemachulat. Angot kobun kwony nenyigis ngwonindo nenaat ko labor nebo kasarta nekoi missing amanyor toretet kobun kanyoik komuch kochilak tigitik ak kobit rarunet nebo koristab oxygen koboto korotik ak eng let kobit kaimutietab fistula.
There are many causes of the condition and predominantly it is obstructed labor where there is no intervention. So when a lady is in labor for long without intervention, injury can occur. The injury occurs because probably the baby is bigger than the pelvis of the mother, and usually there is supposed to be intervention, like to do a cesarean section. So if that's not available, obstruction goes on for very long. Some tissues get compressed beyond the limit that is acceptable. That causes loss of blood supply in those organs, and as a result, if an organ loses blood supply and oxygen supply, after some time it dies off. So that area that dies off can fall out, leaving a fistula.
Akot ngandan kwonyik chechang chetindo fistula ko kitaunen kaimutikab sigisiet, komiten tuguk alake cheimuch koipchi kobit kaimutionitok.
We have talked about the obstructed labor, which is the most known cause. But there are other causes, right? For instance, you can have diseases that can affect the reproductive organs. For instance, cancer of the cervix, sometimes cancer of the rectum, sometimes you can have something like TB of the bladder. That's very rare, but it can happen. You also have conditions that can cause fistula, such as trauma. Trauma includes accidents like road traffic accidents. That's quite rare, but it happens. You can also have rape. You can have, like in some countries where there's war, you can have communities aggressive against others. Sometimes they use rape as a tool that can cause fistula. Some children get fistula as a result of even falling from a tree and accidentally getting pricked by something. That's under trauma. You can also have fistula occurring as a congenital condition, that malformation. And then you can have, to mean that the organs did not develop well as they were supposed to develop.
Kasarta nekakinyor kwony kotindo koimutietab fistula komuch kotoi kobun inendet koimutik cheterter en bortanyin. Chuto koboto neibeti chi kamuget nebo koter beek anan ko murindo nebunu borto. Akot kounoto koibu ng'emisiet nebo barak mising koimutikab kabwatutik.
First of all, we have the physical effects, is what we can see or what it manifests. Then we have the social effects, and then we have psychological. So to start with the physical is incontinence. Incontinence means somebody may not be able to control the bowel or to control their urine. And if you can't control that, then it means definitely you will smell, because that stuff is not supposed to be around somebody. That's why people normally go to the bathroom. But now if you can't control it until that time, it leaks. So you'll have to change many times just to avoid that. But to some extent, it might cause you to smell. Usually fistulas that occur as a result of obstructed labor also come with other problems. For instance, some women will be limping, meaning that one of the feet was affected. That would mean there was a nerve injury to that leg. And so you find them limping for some time. That's also a physical effect.
Koimutietab fistula korebe tekisto ak kondit netindo kwonyik chetindo mionitok akotoi kotorta ichek koba tabandab bororiet. Sosisiet ak katabanet nebune kwonyichutok koiku sobenywan ak boriet nebo atkai tugul.
If we can now go to the social, is normally when you are in public and you have something like a bad odor around you, people will react. And the first people around somebody is usually the family, relatives, or in a place where you have a social gathering. So once they realize there's an unusual smell around one person, then they will start isolating the person. They don't understand what it is, so sometimes they gossip about it. When they gossip about it, now it becomes a stigma issue, like this person is not able to keep themselves clean, this person is careless, this person is foolish, things like that. Because they don't know what it is, and maybe they don't have a chance to ask you what it is. So they make their own judgments, and that is what results to people having their own conclusion and making up stigma. Because of now the social effect, then it comes to the psychological. Because people get abandoned, get isolated because of this smell and all that, then they feel bad about themselves, and they start having low self-esteem. They start feeling worthless. Some of them consider suicide. Those are now the psychological effects. And some studies have shown that more than 40% of women who suffered fistula for some time, even after complete treatment, they have some level of psychological disorder.
Angandan imuch komokyingei kwonyik chechang toretet nebo konyoiset asikoistoengei miletab fistula, ko chang chemotindoi kamuget nebo koityi konyoiset. Nitok ko kosubkei ak olyet nemiten barak nebo konyoiset neyoe sometab mugulelwekwak koek korwotitoet kityo.
The cost of treatment for fistula is expensive because a simple fistula repair and management until the patient goes home should range about 250,000 to 300,000. Where the complex ones can go as expensive as $500,000, depending on the number of procedures and the period that the patient needs to be in the hospital. Most of the patients who get fistula are not able to pay for the service. In fact, most of them, they cannot even afford the national insurance, which we thought was reasonably fair, but still, most of them cannot pay for it.
Koimutiet age neikoek konukut en boriet nekitokyin fistula ko bitonwekab bororiosiek cheterter. Eng kasarwek chechang ko maimuchi biikab boror kong'alalen fistula kosubkei ak yetonutik cheterter. Nitok kotere kwonyik chechang komacheng toretet.
Fistula has been with humanities ever since people started having children, and it's a bit tricky for many people and cultures because of the nature of how they treat sexuality. The fact that fistula is an issue that deals with human sexuality makes it a compound issue. And in that case, a lot of cultures don't like to talk about sexuality issues quite easily, or they have a way of talking about it, maybe segregating women alone, segregating men alone, segregating certain age of people so that they can discuss such issues. So because of that complexity, people don't easily discuss about it. Sometimes they hear about it and they are afraid to take it further. So the little information they have is what they dwell on. Sometimes people think fistula is witchcraft. And that's quite a common thing. Or it is something associated with unfaithfulness. We have seen a lot of people having that mentality. That when a woman is unfaithful to the husband, when she conceives from another man, she might get fistula. It's not true, of course, but it's something that is there.
Akot ngandan tomo kosulda boriet neketokyin koimutietab fistula komiten komong'unet. Tesetai ng'amotik kanyoik cheu Samuel Munyoki koboto kibagengeisiek cheboto Gynocare koboisie beet ak kemboi kotoreti kwonyik kokirinda fistula asikonyor tekisto ak kondit asikosobcho sobonwek chemamiten kendernatet age tugul. Akot kounoto ko en kwony age tugul nekanyor konyoiset komiten elfusiek chebune ng'wonindo en ung'at. Nitok ko kurset nebo kewal atindonietab fistula kwondo agenge en agenge. Victor Korir, Kass TV.